Dr. Therian here, and if you're watching this, we likely talked about allergies during your eye exam. Now understand this video is just to reinforce what we discussed during your eye exam. It doesn't take the place of need for an eye exam. So basically what happens with allergies is we get an allergen, something that irritates the eye, hits the eye, it irritates those mast cells. The mast cells kick off histamine, and that's what causes the eye to be irritated and mad and ticked off. So what I tell all of my patients is whenever it comes to drops for this, you have two different kinds of classes that we got to talk about. One is antihistamines. Those go around and gobble up that histamine. That's what's irritating the eye right now, is that histamine kicked out. The other ones are mast cell stabilizers. Those tell the mast cells that it's okay and not to kick off that histamine to begin with, that cause all the irritation, pain, discomfort, all that fun stuff. And so if you know you're about to have allergies in a month or so, then you want to get one of those mast cell stabilizer drops. You want to use that every day for a couple of weeks to be kind of ahead of that so those mast cells don't get ticked off and mad to kick off the histamine. Now, if you're in the middle of an allergy issue where the histamine's already been kicked off, that mast cell stabilizer isn't going to do you a whole heck of a lot of good. What you really need now at this point in time is you're going to need antihistamine. That's where something like a Zatador comes into play, where you can use that drop and it'll basically go out there and gobble up that histamine and get you where you're starting to feel better. But if you use those in the wrong timelines and for the wrong reason, you don't get as much bang for your buck and you don't get the results that we're really looking for. And so what I look for from a chronic allergy type situation is just are the eyelids so inflamed and sitting there inflamed for so long that it's starting to cause like meibomian gland dysfunction or dry eye issues or something along those lines. And so for the most part, allergies pop up. It's not that big of a deal. We just put you on one of those drops, get you fixed up, rocking and rolling. Occasionally I'll prescribe something like a steroid to really kind of be the big gun that I use. But usually I just manage it with over-the-counter type drops, get you fixed up. And so things to watch out for is it getting worse? If it's getting worse, definitely need to get an eye doctor to take a look at it. Is it just sitting there and lingering? You know, if you're using the drops and trying to get there and it's not fixing, then again, get an eye exam. Things to avoid. Do not use the get the red out type drops. Basically, the way those all work is they shrink the blood vessels. And so if the body's trying to mount an allergic reaction to something and we shrink those blood vessels, it'll get rid of the redness, but the body says, oh no, we can't get there. So it tries to ramp up an even more intense allergic reaction so that when those blood vessels redilate and that medication wears off, then you have a real big allergy reaction and a real big allergy response. And so avoid those get the red out drops. They really don't do you any good. Stick with the true allergy type drops. As always, this video doesn't replace the need for an eye exam. And if you ever have any questions, we're always here.